I think with traveller women, especially if after they've had a child and if they do have to move, it's vital that they have to keep up appointments for them and for the child.
Sleep as well, like you said before, you've got lots of people.
We can give reassurance and what's normal and what sort of signs to look for if a baby's per feeding or if baby's not getting enough at all. So we can advise, which is again really good to have the community midwife come into your home that can give you all that information. Sudden infant death syndrome is it's very, very rare. We don't know what the reason is. Fortunately, it doesn't happen often at all, but you know, we do need to make sure ladies are educated and aware. What we recommend is to always place baby on their backs, always with feet towards the bottom of the cot, not in the middle of the cot, so that way baby can't roll. So we're just tucking the blankets underneath, so there's nothing that can cover baby's face, making sure the temperature is okay, baby's not overheated, and we do know one of the key factors linked to cot death is smoking, so we always recommend not to smoke around baby. Obviously, if you've been taking alcohol or drugs, we highly recommend that you not to have baby in the bed with you, also not to have baby in armchairs. With car seats, we should use them for a limited period of time.
I knew a travelling woman. She suffered postnatal depression after she gave birth to her third child. She didn't get it in her first two children, but she got it in her third child. And she didn't want to know the baby. She didn't want the baby around her and stuff like that. So it is important to learn about that and to seek the advice and help that's there.
Baby blues are normal. They last a couple of days and they go. But if it gets any worse than that, get help. Really, they need help. Speak to the health visitor, the doctor. You know, there is help out there.
I have seen women who have been at the point of feeling suicidal and then through a combination of counselling and some medication have then come back to their normal selves. But if they'd known sometimes that help was there, may have got that sooner.
They should either talk to someone belonging to them, like their mum or older sisters or something, and also maybe to their doctor to let them know that they're not feeling right, that there's something wrong.
There is still a stigma, and I think it's only by talking about it and reaching out for help and supporting each other that we can get rid of that stigma.
I'd like to say a big thank you to all the women that have been involved with this film, because without them this wouldn't have been the success that it has been. So thank you all.
I would also like to give a big thank you on behalf of myself and all the Irish travellers and Gypsy women, to give thanks to Emma and all the staff at the Royal Free Hospital for making this possible. Some of the filming was done by ITMB Youth Group. Music by Waywood Wolf Media. Filmed and directed by Flexible Films.